Hi. So, do you know that most people that have dry mouths, they often present with dry eyes, dry vagina? Do you know the reason? Keep watching this video and I will explain to you how. Okay. All right. So, I'm Dr. Nkachinuma and I'm a dentist and I help improve your oral health literacy. So, yes, let's dive in. So, dry mouth is, dry mouth from the name dry mouth. Basically, you're lacking saliva. Okay. I know that saliva is our best friend. Okay. Saliva not only moistens the mouth, it also neutralizes acid. Saliva helps in lots of things. It helps you in digestion, it helps you in swallowing, it helps you in taste, different things. Okay, so just imagine someone that doesn't have saliva or doesn't produce enough saliva in the mouth. You can imagine what happens. The person will start having bad breath, the person would have caries, a whole lot of things are going to go wrong. Okay, each person normally is supposed to produce at least 600 to about 1000. Okay, 600 to 1000 meals per day. Okay, so just imagine you're not producing up to that. You know that there's a problem. Okay, so now what are the possible causes of what dry mouth? First of all, it can be a physiological thing. It can be physiological in terms of, there's some people that are mouth breathers. Okay, they breathe with their mouth. There's some people that, let's say, the elderly people, so advancing in age. There are people that talk a lot, like teachers. Okay, they can have dry mouth, or stress. Okay, can cause dry mouth. Okay, so that's under the physiological. All right, so we'll talk about habits now. Habits. There's some people that take all this tobacco, cannabis, all these things. Okay, they can cause dry mouth. All right, and then there are some drugs that are prescribed that can also cause dry mouth. Okay, and lastly, you have some diseases like what diabetes mellitus, and you also have what we call Sjogren syndrome. Okay, can also cause that. So now, complication of what dry mouth. Dry mouth. If someone has dry mouth, okay, what can happen? First of all, the person is going to be very uncomfortable. The person will be able to do some certain things, like the person will be able to taste food properly. The person will be able to swallow well. The mouth will just be uncomfortable. The person might come down with ulcers. The person might come down with bad breath. The person might come down with caries, holes in the teeth, periodontal diseases. There are a whole lot of things. In fact, people that wear dentures, okay, they are going to feel very uncomfortable because there's no saliva. So how would you be able to put on your dentures properly? Because saliva serves as a good seal. Okay, so there are a whole lot of things that happens when one doesn't have saliva in the mouth. Okay, treatment of dry mouth. Okay, so first of all, we have the causative approach. So you even need to know what is causing this dry mouth for you to, know how to start tackling the problem. That's the first thing. Then secondly, we have the stimulative approach. So what that means is that we are trying to stimulate the salivary gland to produce saliva. Okay. And you can do that locally by maybe giving sugar-free gums, okay? Or you can do it systemically by giving stimulants. So the person takes it orally, okay, to stimulate the salivary gland. An example of that systemically given one can be pilocarpine hydrochloride, okay. And then lastly, we also have the symptomatic approach. Okay, so that one is that you're basically giving the person artificial saliva. Okay, so that's thank you so much. I hope you learned a lot today. Do well to subscribe. Thank you.